The devastating tsunami in December 2004 killed an estimated 160,000 people in Indonesia's Aceh province and left countless more homeless. In addition to losing their homes and loved ones, virtually all community infrastructure was wiped out, including roads, places of worship and critically needed healthcare facilities. IOM immediately responded to the crisis by treating the injured and assisting medically evacuated patients in returning home. The emergency medical assistance was later followed by medium and longer-term interventions for recovery and revitalization of community health services.
Well, I think it was a very easy decision for us to take. I mean, the devastation caused by the tsunami was enormous and very difficult for most people to understand. But I think that what we at Standard Chartered Bank wanted to do was to make a lasting difference to the lives of the people in Aceh. And there was clearly a very urgent and immediate need for healthcare. And I think working with the IOM, I think we were able to provide an excellent but ongoing solution to the need for medical care facilities in Aceh.
The Standard Chartered Bank in Indonesia has generously responded to the vital need for improved health services by supporting the construction of a clinic in Japakir village in Aceh Besar district and a community health training centre in Juram, Nagan Raya. Construction of the Japakir clinic started in November 2005. IOM adapted its transitional housing model to build this and 36 other clinics around the province to address the needs of specific camp and barrack populations at the request of the Ministry of Health. Construction of the province's first district-level training centre also started in November. Both the clinic and the training centre were inaugurated in December 2005. Since opening, the clinic has been busy serving the 1,320 people who live in the adjacent barracks. One such resident, Yulia Iskandar, takes the short walk to the clinic for her regular checkup. She is concerned about her history of hypertension. She has also brought her 7-year-old daughter Rehulina, who has developed a bad cough. Yulia is attended to in one of the clinic's 2 examination rooms. It also houses a reception, waiting area, utility spaces, bathrooms and office space. The clinic is open from Monday to Saturday, staffed by a doctor, 2 nurses, a sanitarian and 1 volunteer. The medical staff can provide primary health care, referring more complicated cases to the nearest properly equipped hospital.
All the staff are very nice at the clinic and always open for consultation. The clinic is only 1 minute's walk from my place and I find it very useful.
Yulia's blood pressure was found to be normal, but she was advised to stay in close touch so her recovery could be monitored. Whilst there, she also received medicine for young Rehulina.
People come here with mostly infections and colds. That's partly because there is so much dust and wind and easily gets into the water and food if they are not covered well. This is one of the biggest problems for families living here.
The medical staff regularly update the board listing the top 10 health complaints of their patients. The most frequent cases involve respiratory tract infections, followed by skin allergies.
At the moment, the living conditions at the Nerba barracks are not good. In particular, the water is terrible and not suitable for drinking. Many children who live here get the flu, and in fact, all of my children are frequently unwell.
Sanitary facilities at the barracks are inadequate. While there are water tanks, standing water caused by insufficient drainage can act as a breeding ground for disease. This makes the free clinic nearby all the more essential.
The satellite health clinics very useful and helpful for us, especially for people who living in the IDP camp or the refugees camp. Also for the people who living surrounding the IDP camp, also the people who visit their relatives in barracks or in IDP camp. As you know, we know that the service in Satellite Health Clinic is very good.
The Nagan Raya Training Centre, supported by the Standard Chartered Bank, is the first facility to provide centralised training activities for public and community health programmes. The training complex has 2 buildings, a training centre and a smaller dormitory building that can accommodate 20 people. This allows participants from remote villages to attend multi-day training programs.
The last 30 years in Aceh have made them isolated in recent trends in medical treatment, and we thought that providing them with the latest updates in management of clinical diseases would be one of the things that could be really of use to them as they provide improved healthcare services for the people. We thought that the collaboration between IOM and the private sector, represented by the Standard Chartered Bank, is creative as well as innovative in terms of delivering health training for the staff in Nagan Raya.
In April, for example, IOM facilitated training in neonatal resuscitation for 35 local health staff.
IOM has made a relationship with Harvard University. I'm a pediatrician.
IOM consultant Dr. Chris Olson leads a workshop on life-saving neonatal resuscitation techniques and the prevention and management of postpartum hemorrhaging, one of the leading causes of maternal death. With the aid of a child-sized mannequin, IOM nurse Yeti Yulia Ningsi demonstrates how to save an asphyxiated baby. One of the midwives practices the correct use of a technotube, which helps a newborn breathe. It looks simple, but medical staff must be trained to alternate the strength of their exhalations and to time them properly to avoid damaging the infant's chest. The maternal mortality rate in Indonesia is the highest of all ASEAN nations, with 307 maternal deaths per 100,000 live births, according to the 2003 Health Ministry data.
I would say that one of the highlights of our training was when we had one midwife who was able to use her recently learned skill in resuscitating a newborn baby, who was able to breathe spontaneously after assisting that baby and was brought to the hospital. So an intervention within the first 2 minutes of the baby's life helped a great deal, and now the baby is quite healthy and was a great example of how our training has successfully been taught to our nurses and midwives.
More training modules have been developed to conduct monthly training sessions at the centre. Topics include the case management of prenatal and maternal illnesses, health centre management, administration and effective communication. Experts were invited as trainers from various partners, such as Harvard Medical School and Standard Chartered Bank itself.
We have a lot of things and many more to do in Aceh. The first place, we have to build the health facilities that already destroyed, let's say health center or puskesmas and hospital and some laboratories. Also the building of the training center, Polytechnic Kesehatan or health polytechnics. The second thing is we have to build the capacity of the health manpower in Aceh. We hope that by building the facilities and building the capacity of the people in Aceh, we hope that they can make the better development in Aceh in the future.
Back in Yulia's home, the medicine has relieved her daughter's cough. But living in such trying conditions means there is a good chance the problem will return. Behind their smiles, these tsunami survivors worry about the daunting tasks ahead, schooling and feeding their children, finding a new home and rebuilding their livelihoods. Significant progress has been made in the year and a half since the disaster, but many challenges remain.
I think the progress that we've made thus far, assisted by IOM, is very encouraging. But there's always a little voice at the back of your mind saying that you could do more. So I think despite the fact that we've made good progress, and I think that we've helped to set a good training centre in place, helped to put an infrastructure there, which is making a real difference to people's lives now, I think that there's still more to be done. We've been in Indonesia 143 years. We very much feel a part of the community, and we feel an obligation on our part to actually make sure that we're giving help not just today but tomorrow and in the years to come. So we'll be very much involved in this on an ongoing basis.